Hey everyone, this is Dylan here, and today I'm going to be going over the rapid strep test. So this is checking for the presence of Group A Streptococcus, or Group A Strep. Specifically, this is Streptococcus pyogenes. So this test is a PCR-based test, and it's going to correlate with, the presence of having strep throat. And the most important thing when it comes to doing this test is actually the collection. So you're going to want to collect it in something like a culture-based swab. So a regular swab you would use for a culture, in our place it's called an ESwab, and it looks like this. And what you don't want to do is you don't want to collect it in like a viral transport media type swab. So a swab you would use for something like COVID, for example, is not suitable at our place. We don't have it validated for strep testing because this is looking for a bacterium, and obviously a COVID swab or a viral transport media type swab is looking for a virus. So that's the most important thing because it sometimes gets collected improperly, so just make sure that it's the right swab. And then when it comes to doing the actual methodology, it's very simple. You just Vortex your patient sample and add the specified quantity, for example 300 microliters, into the cartridge, and then you just load that up onto the machine, and that just requires a couple scans. And then the actual testing takes about half an hour or so, and it'll come back either positive or negative for the presence of Group A strep. And in regards to reporting, a negative result tends to cross over automatically, and it doesn't require a manual release or anything. And if you get a positive result, then you just have to cross that over manually, which means you'll just press accept pretty much, but it doesn't require a call to the patient's nurse. So that's how you do the strep test. And thanks for watching, and I'll see you next time.